Good morning, everyone. I am Dr. Sujit Kumar. I am consultant nephrologist, Jamshedpur. In today's session, we will discuss the chronic kidney disease or CKD and its association to pedal edema. That is the most common cause of pedal edema, along with its causes, symptoms, and treatment. First, let's see what chronic kidney disease is. Chronic kidney disease is defined as structural or functional abnormalities of kidney for more than or equal to 3 months. That is, the continuing and permanent degeneration of the kidney is known as the chronic kidney disease. The kidney are the vital organ in the human body. They serve a variety of purpose, including maintaining the body minerals and electrolyte balance, assisting in the production of RBC, that is red blood cells, maintaining the acid base balance of the blood, or excreting water soluble waste. Kidney that have been damaged lost their capacity to execute these functions. There are 5 stages of the chronic kidney disease. In CKD stage 1, the kidney is normal with more than 90% of the kidney functioning properly. Stage 2, in stage 2, the kidney function mildly decrease, that is less than 90% to 60%. In stage 3 CKD, the kidney function decrease mild to moderate to about less than 60% to 30%. In stage 4, the kidney function severely decrease to less than 30%, while in the stage 5 CKD, there is kidney failure and is the percent of kidney function is less than 15%. When patient goes into the dialysis, that is kidney function decrease to less than 10% at the stage is CKD stage 5D. Since the kidney can compensate for lost function, signs and symptoms may not appear until permanent damage has occurred. Some of the commonly observed CKD symptoms, depending on the severity, are swelling of the feet and ankle or pedal edema, that is pitting type of edema, nausea, vomiting, lack of appetite, sleep problem, urinating more or less, dimness, mental sharpness, muscular cramps, high blood pressure, and shortness of breath. Risk factor of CKD in India, most common cause is diabetes, and in worldwide, most common cause is hypertension. As we look at the signs and symptoms of CKD, one of the major symptoms is the pedal edema or swollen foot or ankle. So, what is the pedal edema? Pedal edema is the swelling of foot and ankle caused by the abnormal buildup of fluid in the ankle, feet, and lower legs. Edema of the foot can be caused by 2 different mechanisms and can happen in unison or separately. So let us see how is pedal edema linked to chronic kidney disease. Edema forms in patients with chronic kidney disease for 2 reasons, either due to a heavy loss of protein in the urine, most commonly seen in the diabetes and glomerulonephritis, and second is impaired kidney function. Nephrotic syndrome is defined as the significant loss of protein in the urine along with edema. A decrease in a protein called albumin in the blood results in a reduction in the fluid in the blood vessels. The kidney then detects a decrease in blood volume and attempt to retain salts. As a result, fluid collects in the tissue resulting in edema. Pedal edema can also occur when someone stands or sits in the same posture for an extended period. The symptoms of pedal edema symptoms include swelling or puffiness of the tissue just beneath the skin that is stretched or shiny, skin that remains a dimple or pits after being pressed for several seconds. That is called pitting type of edema. Let's take a look at way to reduce pedal edema caused due to chronic kidney disease. Treatment for edema include addressing the underlying cause, lowering salt intake, and in many cases using a diuretics to eliminate excess fluid. It may also be beneficial to use compression stocking and elevation the legs. First is reduce salt intake. Edema can be aggravated by sodium, which is present in the table salt and processed food. Reduced salt consumption can help in the minimizing edema, especially if you are on diuretics. Second is use of diuretics. Diuretics are drugs that induce the kidney to eliminate more water and salt, hence reducing the edema. Because eliminating too much fluid too rapidly can drop the blood pressure. It causes light headache or fainting and damage kidney function. Thus, diuretics must be administered with caution. After using a diuretic, you may need to empty your bladder more regularly. However, when diuretics are used at the prescribed dose, other adverse effects are infrequent. Third is compression stocking. Compression stocking can be used to both prevent and treat the leg edema. Although good measuring and fitting of the stocking can limit the risk of discomfort, certain stocking can cause skin irritation or pain. Effective compression stocking exerts the most pressure at the ankle and progressively decrease pressure up to the leg. Fourth is body positioning. Elevating the leg above the heart level for 30 minutes 3 or 4 times a day can help with legs, ankle, and foot edema. Additionally, elevating one's leg multiple times in a day may not be beneficially for individuals who are working. Lastly, it is not always possible to prevent CKD. Controlling disease like high blood pressure and diabetes, on the other hand, can benefit. If you are at high risk of CKD, you should get regular testing. Early detection of CKD can add to slow its progression. Limiting salt intake, choosing food with low potassium, and having physical activity can help with reducing the pedal edema caused by chronic kidney disease. Thank you.